Let's talk about foods and nutrients to speed up the healing process. If you break a bone like I did or suffer from a serious injury as an athlete, there's ways you can help speed up the healing process. Now, before we dive in, make sure you hit the like button and subscribe for more sports nutrition tips. So here we go. First, many athletes make the mistake by cutting their calories after they get injured. They typically think they're going to gain weight or they don't need as many calories if they're not training. This is a big mistake. All right, energy and expenditure actually increases depending on the severity of the injury. So long bone fractures, for example, may increase your basal metabolic rate by 15 to 20%. Your basal metabolic rate is the amount of energy that is expended at rest. This is the amount of calories your body needs to operate at rest. So if your BMR is 2,000 calories a day, you need an extra 300 to 400 calories to heal a broken bone. Now, if your overall energy and protein needs are not met, body tissues such as muscular and muscles, ligaments, they'll begin to break down. This will compromise healing and may prolong your recovery, period. So first, let's discuss protein. Half of the volume of your bone is protein. Dietary protein builds and repairs bones, it supplies essential amino acids, and when a fracture occurs, the body gathers protein building blocks together to synthesize a new structural bone protein matrix. Now, in addition, protein supplementation increases growth factors like insulin-like growth factor 1. Now, IGF-1 is a polypeptide that exerts a positive effect on skeletal integrity, muscle strength, immune response, and bone renewal. Now, protein malnutrition leads to a rubbery callus type deal compared to the rigid calluses of those with adequate or high protein intake. In fact, studies show fractures heal faster with 10 to 20 grams of increase in protein. So how much protein do you need? Well, research suggests an intake of about 0.45 to 0.68 grams of protein per pound of body weight. I like to go with the high side, so if you weigh 170 pounds, multiply 170 by 0.68, the higher end of the spectrum. And at 170 pounds, your daily recommended protein intake would be 115 grams. Now, you can get your protein from meat, poultry, fish, eggs, milk, cheese, legumes, soy products, nuts, and seeds. However, red meats can lead to inflammation, which is not great for healing. If you do eat red meat, go for grass-fed, grass-finished beef. And no, dairy can make constipation worse, which constipation, unfortunately, is a normal side effect of surgery and painkillers. So be a bit cautious on how much dairy you consume. Now, one way to get enough protein is by drinking what we like is Whey Awesome Sauce. Whey Awesome Sauce is a pure whey isolate protein designed for our high-performance athletes. You can check out more about that at cellsauce.com. Next, you want to make sure you're getting adequate carbohydrates. Carbs give your body energy for healing, and they help prevent protein and muscle breakdown. Just make sure your carbs are complex carbohydrates and not processed simple sugars. The processed carbs and sugars increase inflammation and ultimately slow down healing. So get your carbs from things like fruits, vegetables, legumes, rice, grains, and sweet potatoes are always awesome. One easy, clean source of carbohydrates is carb sauce. Many of our pro and amateur athletes use carb sauce both during exercise and during injury to increase their carbohydrate intake. You can check out more of that at cellsauce.com. So the next thing you want to do when you're injured is boost your vitamin intake. Here's a few critical vitamins to help speed up your recovery. 1, vitamin A, it helps wound healing and growth. It helps maintenance of skin. It also stimulates the immune response and helps form normal outer and inner skin. Good sources of vitamin A include carrots, leafy greens, red bell peppers, sweet potato, and cantaloupe. Another vitamin you want to boost is vitamin C. It's needed for speed and strength associated with wound healing. It forms collagen in the bones, cartilage, muscle, and blood vessels. It's also one of the most important antioxidants and anti-inflammatory nutrients. In severe vitamin C deficiency, collagen becomes too unstable to function properly, which results in skin lesions and fragile blood vessels. Plus, a tendency to black and bruise, like bruise easily, is a sign of vitamin C deficiency. Because of vitamin C's essential role in bone collagen formation, it's required for fracture healing. Good sources of vitamin C are things like kiwi, oranges, tomatoes, strawberries, broccoli, bell peppers, and potatoes. Next on our list is vitamin D. It's an essential nutrient in the formation, maintenance, and repair of bones. It's the primary regulator of calcium absorption, and without adequate vitamin D, calcium blood levels drop, making less calcium available for fracture healing. Plus, we know that vitamin D, in conjunction with vitamin K, stimulates the transformation of fracture site stem cells to bone-building osteoblasts. So that's good. Good sources include fortified milk, egg yolk, salmon, tuna, and direct exposure of skin to sunlight 10 to 20 minutes 2 times per week. But remember, it's without the sunscreen. And next on our list is vitamin K. Now, vitamin K is an essential part of the biochemical processes that bind calcium to bone, and it's required for proper formation of the osteocalcin bone protein. In addition, vitamin K helps conserve calcium by reducing the loss of calcium in urine. So now that you know which vitamins are crucial, let's talk about minerals. The first mineral important to bone healing is calcium. Calcium is an essential mineral for bone repair, soft tissue healing, proper blood clotting, muscle contraction, especially normal heartbeat rhythm. Good sources of calcium are milk and milk products, as well as dark green leafy vegetables. Now, moving on to the next mineral, it's zinc. Zinc is involved in the early remodeling of collagen and may accelerate wound healing in patients following surgery. Primary sources include oysters, lean meats, fish, poultry, legumes, whole grains, breads, and cereals. Now next is the mineral copper. Copper is necessary for collagen formation as well as bone and joint integrity. See, copper is in most foods, but especially oysters and other shellfish, whole grains, legumes, nuts, potatoes, dark leafy greens. Lastly, additional electrolytes may do your body good. Post-operative surgery patients are prone to electrolyte imbalance. This is often a result from the loss of blood and bodily fluids, the stress response to surgery, intravenous fluid administration, blood transfusion, and the underlying surgical disease. So adding a clean source of electrolytes can help your body rebalance and rehydrate. One of the best drinks you could use to help recover from injury is hydration sauce. Hydration sauce includes key electrolytes, important amino acids, and complex carbohydrates. So you can have a closer look at hydration sauce by visiting cellsauce.com/hydration. I hope this helps you in your quest for faster recovery. Remember to like and subscribe, and I will see you on the next video, and it'll be post-surgery. So next time you see me, I have a plate and a whole bunch of pins and some sutures, I'm sure. All right, we'll see you soon.